I'm having my ears reshaped, basically made smaller. I've been thinking about it forever, it seems. Dr. Barrett has done a chest reduction for me, which came out fantastic. And recently he did a revision rhinoplasty for me, and I was thrilled with that. Dr. Barrett is outstanding. Everything he does is meticulously done well. I had no anxieties at all about using Dr. Barrett, and I recommend him highly.
We're here to do ear reduction surgery. It's a combination of reduction of the helix of the ear and also the earlobe. So if you come over here, I'll show you guys a little more closely. So here's our patient's ear, and it is a little bit large compared to the rest of the area, and as you know, ears continue to grow as we get older. So what we're gonna do is we're gonna do a helix reduction and bring this over like that, okay, without creating that crease there. And then also we're gonna do a small earlobe reduction as well. So he'll get a reduction here, and he'll get a reduction here for smaller ear. So our patient is breathing in Pronox. This is a nitric oxide oxygen mixture that's helping him relax while we do the numbing medicine. Once it's numb, he's not going to feel anything. Yeah.
Yeah, this is great.
Yeah.
What a difference.
Yeah.
I started to look like those foxes before you got older.
That's right. Beautiful, tiny little ears. Comprehensive ear reduction, all right? It was not a prominent ear surgery. We did an ear reduction. That's a combination of shrinking the top and the bottom part of the ear. So we did this under local. There was no anesthesia needed. So we used Pronox, which is a little bit of nitrous, a little bit of oxygen, can be administered in the office to relax our patient while we injected the numbing medicine. Once you get the numbing medicine in, you don't feel anything. So then we first took care of the earlobe. We were able to reduce that with a wedge technique. That went right into here. You're never gonna see that scar. Next thing we did is we did our helical reduction, okay? Basically we brought this, cinched it in further like that, took out a little strip of cartilage, and so that this top portion and the bottom portion are thereby smaller. Again, wasn't a prominent ear thing, so we didn't have to set them back, but we did have to make them smaller. 2 weeks, all of the stitches will be out, and around 6 weeks, his swelling should be down for a final result picture. I can't wait to show you then. If you have questions about ear surgery, check out my website, drdanielbarrett.com. Feel free to leave your comments, questions, feedback right here in my YouTube page. If you have prominent ears, if you have large ears or messed up earlobes, let us know. And if you like what you saw today, thumbs up and hit subscribe so you can see more cool videos just like this. Thanks for watching.
I was surprised really how quickly I recovered. Once the surgery was done, I wasn't full of bandages and so forth. My ears feel pretty much normal, and I'm very pleased with the outcome. I just want to thank Dr. Barrett for another job well done. I'm very, very pleased with the doctor, and Dr. Barrett's the only surgeon I would trust with my face.
2 weeks out from the ear reduction is a total ear reduction, not just the earlobe. So if you turn for us just as gently this way, you can see that we were able to shrink the earlobe area and also the helix. And then if you turn over here on this side, you can see the same thing. And the beauty of this is that the ears still match. They're not too small. They were just very large compared to his proportions earlier. So we did a gentle reduction, probably about 15 to 20%. And that's it. That's all we needed to do. And now this is much more harmonious to the rest of the proportions of the head. So it's a very subtle thing, but it makes a big difference. It's very refined.